This is the Injury Report, presented by NYU Langone Health. In the past week, injury news has come down surrounding two of the biggest stars on the New York Yankees. The fans, they've got questions about that, and we are going to get some answers on this edition of the Injury Report. Joining me to help with those answers is a sports medicine physician with NYU Langone Orthopedics, Julia Iafrate. Dr. Julia, how are you doing? Welcome.
Thank you so much for having me. I appreciate it. Great to be here.
Glad to have you here. Now, look, Yankee fans, they're anxiously awaiting the news about their ace, Gerrit Cole, and what exactly is going on with his elbow. Cole reportedly avoided a UCL tear. Would that have meant Tommy John surgery had that happened?
Right. So that's a good question. So it's interesting because he was able to throw a couple of innings, obviously, back on March 1st, and then hadn't really appeared in a game since, besides doing some simulated throwing, I think on March 7th. And then they were worried, he wasn't recovering between innings. And so they said, is there a UCL tear here? Which is a valid question to ask with any pitcher. And then they were able to get imaging, which, we'll get into a little bit more later, but basically didn't look like there was a UCL tear. But if there had been, depending on the severity of it, a lot of times, yes, that would have meant Tommy John surgery.
And, Tommy John surgery, that is not what Yankee fans would have wanted to hear there, Dr. Iafrate. Now, the timetable for his recovery right now is just to rest 1 to 2 months. Does that seem like an accurate timetable for his recovery, and how likely is it that it's longer until he's back in the rotation?
Yeah, that's a great question. It honestly depends on what this injury ends up kind of coming to fruition, right? So if we think that it is more an issue of the UCL is just sprained because it's a ligament, right? So it can get sprained just like your ankle could. If it's just a sprain, then 2 to 3 months is perfectly reasonable. However, if this is more of an issue with some of the flexor tendons, which all go down the arm and help with some of those pitching motions, then potentially if there's a small tear, for example, in one of the tendons, that might cause a little bit more time added on to the rehab. Same thing if there's a bone spur or something problematic within the actual joint itself. So there's a little bit more that we have to sort through here before we can say definitively how long he's going to be out.
Right, and it's so tough to say definitively how long Gerrit Cole could be out. And anytime you have these kind of injuries, as you know, people want to get different opinions. So got to ask this because fans want to know this. Is it likely that different doctors would have varying opinions on such an injury as this right now as they're trying to get more information?
Yes, absolutely. We are human. We like to say that we are very good at what we do, and we are, but we are human. So we all are going to have varying opinions depending on what we see. The important thing here is that he gets a good physical exam done, because imaging is helpful, but a physical exam is going to help us treat the patient or the individual, the athlete, and not the picture, which is the more important piece here. I think that we also, as physicians, we see and we look for what we know. So if you're seeing a specialist whose specialty is, elbow injuries, which of course that's what he's doing, that's why he's flying out there. I think that we're going to see that we just need to make sure that we're getting the same consensus, because this could be a big make it or break it injury for him, depending on what we do and what we see unfold in the next coming months here.
And you talked about him going to see a specialist, and some of the latest news that we know is that he will go to see a surgeon in person. What would that surgeon see in person that they couldn't see on an MRI, just so our viewers can understand that?
Yeah, so the important thing is dynamic testing, right? So we want to reproduce some of those motions Cole has been going through with his pitching biodynamic movement, because it's the biomechanics that dictate how sturdy that UCL is or how strong those tendons are. And a physical exam is going to get us able to test that. Both, CT, MRI, and X-rays, all of those images, they're all static images. They don't allow us to see anything dynamically. So a physical exam lets us do that. I don't think he has had a dynamic ultrasound done, but that would be the other thing that I would want to do on him if I were seeing this individual. And the reason for that is, again, we can test them dynamically. We can actually strain the ligament by testing the motion and then scan it to see if we see any gapping in it.
All right, and we'll see if all that is done, and we can get more information on that. Now, when it comes to injuries like this, as you know, doctor, fans are hoping that doesn't have to have surgery. So if he doesn't get surgery and returns this season, is there a chance that this injury could flare up again, potentially get worse? He's usually very durable. Gerrit Cole has been, but he's had trouble recovering this spring. So if he doesn't have to have surgery, is this something that can, flare up again for him?
Yeah. I mean, this is a very important player for the Yankees, right? So they just can't afford to get this one wrong. And so I think the big thing here is going to be making sure that everyone has that consensus. If it does end up that he's out for a couple of months, rehabs it, does well, and comes back, there is certainly still a possibility that it gets re-injured. Like we had alluded to, if he is looking at Tommy John surgery, it would depend on whether or not they try to repair the ligament itself versus actually do a Tommy John's. If they repair it, we're looking at probably returning early 2025. If they do Tommy John's, we're looking probably at missing the entire 2025 season. So that's a big deal for them, and they really need to sort through this and take their time making that decision.
Yeah, a huge deal for Cole and the Yankees in terms of how they move forward, not just his health, but then also roster construction for the team. But it isn't just Gerrit Cole, as you know, Doctor. Another big name for the Yankees is a bit banged up, and that's outfielder Aaron Judge. Anytime you have to have an MRI, as you know, fans get worried. Doesn't sound good, but the MRI on Judge reportedly came back clean. What does that mean, and what were the doctors looking for with his injury?
Yeah. So it's interesting. His injury, it seemed like it was more of a overuse injury. He was saying that he was doing these repeated swinging, motions all through November. Not to mention, we do know he had that toe injury before, which is probably going to throw off his biomechanics a little bit. And so that might have caused him to force a little bit more stress through some of the abdominal wall muscles. I'm not worried about his hip. The concern here for me is more his oblique musculature. So our abdominal wall is made up of four main muscles. You have your transverse abdominis, which is like a girdle muscle deepest inside. And then you have your external and internal obliques, which crisscross each other and give you kind of those, that cut six-pack side abs, the deep V, if you will. And then the last one is your rectus abdominis, which is our actual six-pack abs. In him, what I'd be most concerned about is maybe an oblique muscle strain or tear. And so that MRI was probably looking for that.
And oblique muscle strains or tears, not easy to recover from. And you mentioned this, Judge reportedly has been experiencing discomfort on the follow-through of his swings. And the Yankees, you know this, they need his swing to be at 100%, especially coming off of that toe injury last year. Now, NYU Langone doctor Harshil Mehta said injuries are, quote, rarely only located in the abdomen. So what else could be going on here with Judge?
So the other thing that Dr. Mehta was kind of alluding to is that sometimes it's not just one muscle, right? It's a kinetic chain issue. The other thing is whether or not there's maybe a nerve entrapment secondary to that. So if you do get a muscle tear in those oblique musculature, you can actually get a little bit of blood in the area potentially, or get swelling of the muscle, and that can actually entrap some of the little peripheral nerves that we have that run through our body. So he might be looking at having, a small impingement of his anterior cutaneous nerve or the ilioinguinal nerve, which will cause pain and a little bit of dysfunction into that area. And again, the other thing here is we want to make sure he's going through that kinetic chain and making sure he's getting that full follow through in the upper thoracic region, his hips and core, and then all the way down to his knees and toes.
And you had mentioned this, Dr. Iafrate, that Judge believes the discomfort had come from overworking his swing in the offseason. Do you agree with that that's what could have happened? And do you think rest will be enough to get him back healthy right now?
Yeah, I think it's very feasible, certainly. So I would say that makes a lot of sense to me. And given that the MRI looks pretty good, again, that's reassuring. If he is continuing to have pain with after he rests for a few weeks, what I would want to do again is look at those peripheral nerves a little bit better. They're very small. We cannot see them well on MRI. And so again, this is where dynamic scanning is necessary. So potentially an ultrasound to look to see if any of those nerves are getting impinged between those muscular layers.
All right, we will see a lot more to go on the road to recovery for pitcher Gerrit Cole and outfielder Aaron Judge. We will see how that goes. Dr. Julia Iafrate, she's a physician in sports medicine for NYU Langone Orthopedics, doing a great job. Thank you for joining us on the Injury Report, breaking it all down and answering some of the questions that fans have about these injuries. We appreciate you.
Anytime. Happy to come back anytime.